The world is facing a global public health risk. That's the warning from scientists who say cancer will claim the lives of 9.6 million people this year, up from 8.2 million in 2012, according to the World Health Organization's Cancer Research Agency. Officials say the growing numbers are due to several factors, including lifestyle and diet.
One of the most dramatic changes, if you think about introduction of new risk factors where the exposure has really changed, it relates to body mass index, to obesity, and to reduced physical activity.
In many wealthy countries, health education programs are helping to reduce the cancer rate, but in developing nations, the disease is on the rise. Based on figures from 185 countries, the World Health Organization estimates that half of the 18.1 million new cases predicted this year will be in Asia. Africa has 7% of the world's cancer cases, but the death rate is higher. Europe accounts for 23% and the Americas 21%. Lung, breast and bowel cancer top the list of fatal cancers worldwide.
Good morning, everyone. Welcome. Gareth Presh, founder of the World Health Innovation Summit, and I'm delighted to welcome colleagues today from Africa and in the UK. And for those tuning in around the world, we're discussing advocacy this morning in Africa, and we're going to focus on cancer. I'm going to do a short round of introductions. The video that you've just seen just gives us a short indication of the challenges that we face in the health service and globally around cancer and NCDs, non-communicable diseases. I'm hoping that this session will give an insight into how we can actually change the course, shall we say, because we have this prediction of, people suffering from cancer and rising cases over the next few years while our resources are being diminished. And I really believe that this group here in front of us, that we're working together, have an opportunity to engage in the community and bring health literacy and engage in a way that, shall we say, changes that course of action. I'm going to start with Jenny. If you could just do a very short introduction, tell us who you are, what you do, and your passion and role, and then we'll go to Dr. Mwande, and we'll speak to Lamek in Kisumu and also Humphrey. So Jenny, delighted to welcome you here this morning, and I'm also just want to say that I'm grateful for Jenny's support that she's given me over the last couple of years, particularly around an insight into youth engagement.
Thank you, Gareth, for having me. So my name is Jenny Katenge, and I am a civil servant. So a lot of the work that I've been doing is very much focused on advocacy, and then in addition to that as well, I've been doing a lot of work with Gareth around WIS, especially focusing on Africa and youth engagement. I think this is one of a passion of mine, I think in particular growing up in care and kind of being in a system where, it's designed to kind of not only kind of have you institutionalized, but there's all these, taboos around being in the system. And I think for me, I have so much to kind of put in terms of my experience. So, this is where my passion kind of lies.
Thanks, man, Jenny. And we'll get into the discussion around how youth can be empowered and take part in this discussion. And I think it's an important piece for Africa because they've such a youthful continent. Naz, Dr. Mwande, you are the vice chair of TUADA. Tell us a little bit about yourself, your passion, and I have to say the work that you do in the UK to support Africa is highly commendable.
Yeah, thanks very much, Gareth. My name is Nasibu Mwande. Basically, I'm an emergency medicine physician in Cumbria. That's where Gareth lives. And I've been doing it for quite a while. Originally from Tanzania, and like Gareth said, I'm the vice chairman of TUADA, which is Tanzania UK Healthcare Diaspora Association. And our main objective is just to tap in the skill that we have with the diaspora here, so we can give something back to our community by just getting that collaboration, because in a way, you can't get the best of both worlds because we know how things work here. We get how things work in Tanzania. So we can combine at a level playing field so that we can just share, have a shared learning, and that's the whole idea. And we do this via an education. We're going to talk about that later. Try to share or bring in people to disseminate some kind of education to the community, because in technically health is being built in the house, not out in the hospital, but at home. And that's why we try to get the message to. Let's start building health at home. So I'm looking forward to have this discussion.
Thanks a million for that, Naz. I'm going to go to Lamek, who's in Kisumu. And Lamek, maybe you can give us a quick insight into your work and particularly around cancer advocacy. You're on mute.
Thank you so much, Gareth. Are you getting me?
Perfect, Lamek. Go ahead.
Hello, are you getting me?
Go ahead.
Okay, thank you so much. My name is... Yeah, thank you so much, Gareth. My name is Lamek Koyo. I'm working... Are you getting me?
Yeah,
okay, thank you so much, Gareth. My name is Lamek Koyo. I work at Kisumu City Cancer Organization. It's an organization based in Kenya, Kisumu, western part of Kenya. And our work involves cancer advocacy and awareness. And under advocacy and awareness, we focus on prevention, early detection, treatment and management. Under treatment, we do more of referrals because we work closely with the referral hospital, which is next to us. And then we have a program called Hope Beyond Cancer, which is focusing on patient navigation, treatment, and we have a support group that we are running. And then we are also having nutrition. Under nutrition also, we do nutrition education to the cancer patients and caretakers. Then we have another program that is called Inspire. Inspire program is we are inspiring the community on economy, capacity building, and also agriculture, and also we are doing education for the children. So those are some of the programs that we are running under Kisumu City Cancer Organization. I'm very passionate about cancer advocacy, especially in Africa, because we realize that a number of issues have not been addressed. Yeah.
Thanks, Lamek, and we'll get into those areas, those programs. I'm actually quite interested to see what learning, because I'm absolutely 100% sure that there is learning from Africa. We can learn from you as well. I'm fascinated to see how your programs are linked into agriculture. That's an exciting development, because our food is very important. So I'm looking forward to that conversation. Stephen, perhaps you, as a nutritionist, you could give us a bit of an insight into your background and your passion towards cancer. Go ahead, your mic is muted, I think.
Unmute.
Quite loud.
Yeah, thank you so much, Mr. Garrett. My name is Stephen Osheng, and I come from Kisumu, Kenya. Okay, thank you so much, Mr. Garrett. My name is Stephen Osheng from Kisumu, Kenya, and I'm so much happy and humbled to have joined the WIS community. And personally, from my academic background, I am a nutritionist based at Kisumu City Cancer Organization. And with Lamek here, just like I said, personally here, I give nutrition support to cancer patients. We also advocate for the nutrition education to caregivers. And it is my passion that I may be able to provide nutrition stuff to the cancer patient, because we have realized that cancer really go in hand with the nutrition. And nutrition is one of the major aspects we consider when we want to focus on patient navigation as far as cancer is concerned. And at first, I was passionate on how I can deal with malnutrition with the underage, that is 5 years and below. But as time went by, I developed interest. And over a period of time, I've been trying to see how is cancer, because particularly Kenya, we are still not able to, we don't have much information as far as cancer is concerned. We still have people stereotyping what is cancer. We have not yet have the knowledge that cancer is just like a disease that we are able to overcome. People are still thinking that cancer is a death sentence. So to some point, I got interested that why is it this field so much backward? People are like, oh, this cancer is maybe for a particular category of people, like for the rich or particular class. And so I developed my interest that let me see. And I realized that it is so much wide, and I want to develop interest so much to be able to associate with the cancer patient, be able to give nutrition education, nutrition support, and also enlighten the community about cancer, because basically we don't want a situation where somebody is like, after diagnosed by cancer, the only next thing is to see death. So we are trying to enlighten people to see the positive aspect of this. And so that is why how I came to develop this issue, because I wanted to make sure people understand cancer, be able to accept the fact that cancer is real, and now that it is real, it is not a death case. So there is a way to go about it. And so particularly with LAMEC, I am so much happy because over time we have been giving weekly health talks on nutrition, and we normally post them on our webs, that is Kisumu City Cancer Organization, and that one we do occasionally provide talks, and also we normally visit the cancer survivors, and in that particular area we normally give them nutrition support. We teach them the importance of nutrition, and one of the major important aspects we have included is to be able to enlighten the caregivers on the nutrition part of it, because we realize that once you're diagnosed with cancer, even your diet has to be recognized or has to be attended to in a special way. Something that if you give to a family will be like, oh, this particular patient will giving us rules that we need to cook this, we need to prepare meal this way. So we need to make the caregivers accept the new normal of dealing with a cancer patient, that even as you're preparing meals, you are considering that, oh, I need to see this and this. So thank you so much. Even as I return back mic to you, and also I need to include that in the Kisumu City Cancer Organization, I'm also working closely with the digital health campaign, and that is what we do.
It's a brilliant insight, Stephen. Thanks for setting the scene as well, because you've given us great context in terms of how the discussion can go. Because cancer is not just a death sentence, and you know, it's very much about how we react to the diagnosis as well, and also there's the fear. And I find myself, even in the Western society, we have a lot to learn in terms of fear, because when most families are touched by cancer at some point in their life, and what happens, and I can speak from experience, is that many people are afraid to even talk about it, or you lose friendships. Your closest friends actually surprisingly walk away because they don't know how to tackle this issue. So during this conversation, I hope we can kind of get into how people can address this. It's, I think, very simply, if you do have friends or you do know someone who has cancer, the most important thing to do is to be there for them, and just to even give them a call or a text message to say, can I help you? Or do you want to meet for a coffee or something like that? Because it's psychologically so draining when you have these diagnoses. So, Humphrey, perhaps you could give us an insight into your work and from a clinical perspective in Kenya.
Okay, thank you so much, Gareth. First of all, good morning to all, and I'm greatly honored to be part of today's special discussion on cancer advocacy in Africa, realization of SDG 3. I'm Humphrey Onyango, a clinical practitioner at St. Monica's Hospital in Kisumu, and I'm a member of the Kisumu City Cancer Organization as a medical representative, besides being a member of the cancer support group since I'm a cancer survivor. And majorly, the key roles I play at the organization first is being offering the medical technical assistance to the organization, And I also participate in the outreaches and general cancer awareness creation and outreaches organized by the organization. Besides that, we also journey together with the patients, cancer patients. At least we take them through the diagnosis, understanding their diagnosis, what is involved in their treatment, the side effects they may experience along the way, and general survivorship and maybe palliative care. So that's what I do at the KCCO.
Thanks a million, Humphrey. It's and thanks also for giving some context. And I think your insight as being a patient as well is so critical in these circumstances, to show that you can survive and that you understand the process as well. Part of the problem, I would say, for most people who are diagnosed with cancer, is how do you navigate the next couple of months? How do you understand how the system works? Because it can be very confusing. I'd like to go back to Jenny and just, Jenny, ask yourself from a youth engagement perspective, because one of the things that I am very excited about in terms of the future, and if we look at our youth of today, 18 to 24-year-olds, about 3 or 4 years ago, I went to an event which was focused purely on youth engagement. And what I found so heartwarming was the fact that 18 to 24-year-olds, they were only interested in volunteering, okay, and taking jobs with NGOs, which means in the next 10, 20 years we're going to have this huge shift in social society towards purpose-driven activities. And so can you give us an insight into how you feel from even a cancer perspective, but from an advocacy perspective, using digital technology and social media, how do we bring those volunteers in?
So I think one, providing leadership opportunities. From my experience, I think youths have a lot of ideas that they want to kind of not just implement, but put forward into action as well. So I think having these leadership opportunities, I think gives them, a good chance to kind of test out not only whether their ideas make sense, and most importantly, whether it's useful to the community. So I think from my perspective, what we need to start doing is having skilled professionals intentionally kind of building discussions about leadership and practices that kind of help to develop these skills into their curriculum. And I think for me, I'm a big advocate in I want the youth to become lifelong learners and being open and curious, and we need to kind of create that platform where we can kind of work on that.
Absolutely. NAS leadership, this is always coming up, particularly in the health space. I define leadership as those who create more leaders. That's my definition of a leader. Also, embracing trust. And when I worked in the health service, it's given me such a fantastic opportunity, the health service. I'm totally indebted to it. And working with yourself and colleagues, we have that in abundance, but we also have the other side of it, which is constraining, which is the fear element within the system where it's all power driven. How are we going to address this, in terms of empowering youth, clinicians coming into the system, but also then the patients as well? Because one of the biggest fears for patients in cancer diagnosis is asking questions. It's such a fear. So would you have some advice? You're on mute, sorry.
Okay, thank you, Gareth. I think you're right. Fear is, why do people fear about this diagnosis? Because I think most of the fear comes from unknown, because people that don't know what to expect or what's going to happen to them. And I think when we talk about the leadership, that the leadership have to come with self-dedication. I mean, one wanting to make a difference, want to show the way. That's what a leader is, showing the way, seeing what other people cannot see, and that's what we do. So because of cancer is a really bad diagnosis, I think the most important thing to help people ask the right questions is important that we provide them with the information. What is cancer? Because most of the time people will seek help or will come to the emergency department, come to hospital at a very late stage. So what do you do then? There's nothing much you can do apart from making them do palliative care and a thing like that, which is probably for Africa is not a big thing yet. And so, I'll give one example. There's a doctor in Tanzania called Dr. Helen Makwani, she wrote a fantastic book about cancer in Swahili, and that is very, very important because because as medics we speak a very strange language sometimes, and because we train in English, sometimes some of the words you don't have in Swahili. So, and I can speak to a fellow medic, but when it comes to speaking to lay people in the community to give that information, it becomes very tricky. So this book called Ijue Saratani, which Get to Know Cancer, is a very, very book, and it's saying they're trying to get it to be a mainstream book around the country, which are probably going to be good for the whole of West Africa. And I'm trying to connect and work with Helen as well to find some ways where that we can connect and get this information to the community and to the people, because in Tanzania, 80% of the people who get a diagnosis of cancer will die, and that's quite a lot of people. And the cases, they are being rising every year. About 42,000 people get diagnosed, new diagnosis of cancer, and 28,000 of them will die. And that's quite more than 2/3. So I think we need leadership and a leader to engage and see this is because it's one of the biggest NCDs in Tanzania, for example. It's a leading NCD. So if we engage with the communities, give them the information in the language that they can understand. And I think so if I feel in a certain way, I can go to the doctor or go to Hessen and ask the right questions, because if you don't know, you cannot ask the question that matters. And I think to me, that the key, the language we use as medics will be very important in tackling cancer, and finding ways of getting all this information down to the bone, to the people.
I totally agree, and we had a comment in there from Pauline Wright as well, who's joined us, who's talking about the diagnosis of her cancer and a booklet being given, and I totally agree. And I think we've got digital means that we can also address. I know there's some good technology being developed in the UK that can be shared in Africa. Exploro is one. That book you mentioned, Naz, what we'll do is we'll post that in the comments so people can actually access it. I think language is very important. I'd like to ask Humphrey, from a leadership perspective, you've had the experience of going through this system. You are a leader within Kenya. We need your story. Can you please give us an example from your perspective, from when you were diagnosed? How did you feel? How did you manage to navigate the system? Because it's very important that you show that leadership in terms of saying to other members, Naz gave the figures there, they're phenomenal numbers, over 40,000 people diagnosed with cancer. And I said to Jenny earlier that the fact that 80% of those people are dying from cancer, that really isn't acceptable, because in the UK, for example, that just doesn't happen. Now, I appreciate that we don't have the resources at the moment within Africa. However, we do have opportunities through the Sustainable Development Goals to work with the African Union, to work with the partners such as the faith communities, to bring investment to Africa to roll out these projects. So I don't think it's all about us using our shared resources, our shared knowledge and our wisdom to execute those projects, because I don't think there's an excuse. Saying that there's no money is just an excuse. We can go and generate the cash ourselves because we have the methodologies to create economies. So this is up to us in terms of our action points. So Humphrey, perhaps you could just give us an insight from a leadership perspective on your side.
Thank you so much. And first, I would like to confirm that the situation in Kenya is more or less the same like the situation in Tanzania. And it calls for greater leadership role for one to survive cancer. And I agree that the community involvement as the first step of cancer prevention is key in this. And for example, in Kenya, in Kenya, where cancer being an English word, and the translation into other languages will make it much better for individuals more so in the rural setup to understand what cancer is, what could be the predisposing factors, and how they could be avoided. Maybe from personal experience, I can confirm and ascertain that cancer journey is not a walk in the park, and multi-sectoral organizations or support or departments are needed for one to journey through it. And maybe as a leader, leaders are really needed for ahead this. And this really
Can you mute?
first time at least a minister talked openly about his cancer status, and that was quite encouraging for the survivors. And currently, even us as part of the support group, cancer support group, survivors talking about their status is very key, because it gives hope to those who are hopeless. Because cancer in Africa and more so in Kenya, there are some people who believe it is maybe evil spirit or sort of bewitchment. They don't really see it as a medical condition which can be cured through modern medicine. So talking about it openly, engaging the community to understand what it really is, and be positive about it, and walking through the journey is key in this. So I totally agree that as a part, leadership role is needed, and more so the political will is very much influential in this. And also as survivors, if we walk through the support groups, and we encourage the clients, the patients themselves, and also we talk about it to the general public in terms of what is involved, what the risk factors are, and how they could be avoided is very important.
And the thing about cancer is there's so many factors, and you're so right. We need to tackle this and address this issue around misunderstanding of cancer, because it can come from many things. Most cancers derive actually out of like stress, nutrition, diet. However, there is the situation, unfortunately, for young children and that where it's genetics. So there's and so we do need to understand the dynamics, and there's many factors. For example, I've no doubt the likes of air pollution affects cancer, for example. These are the sort of things we need to look at. Microplastics in our food in the future that we see now in our fish, they are going to cause cancers. These are the sort of things we need to understand, that we can put preventative measures in place. Lamek, if you're there, perhaps you could give us an insight into the work that you do on the ground, the talks, and then we can go to Stephen and get an insight into the nutritional side. That would be great. Lamek, can you hear me?
Yeah, thank you so much, Gareth, for this opportunity once again. I just want to say that at Kisumu City Cancer, we've really we've involved a lot in terms of awareness, prevention, and early detection. We normally engage on media most frequently, community radios around here. This year we've done like around 5 community engagement, and every time we go to the community radio, we have to go with one of the survivor to share the story, and also to get involved in cancer advocacy. I want to agree with Dr. Nasibu. In Africa, we are very, very, very far from reaching the mark in terms of cancer advocacy, because it has been linked with witchcraft a lot, and it has been linked with a lot of taboo. There are types of cancer that you cannot discuss openly, especially the cervical cancer for women and the prostate cancer for men, because it's touching genitalia. So when you talk about it, people intend to close up their ears, and they think that you're not supposed to talk about private parts in the public. But those are some of the things that we are trying to engage, that because there are more, currently as we speak in Africa, cancer is leading and is coming up, and we thought that breast cancer was the leading cancer among the women, but right now cervical cancer is coming up because of HIV infection and some other factors, you see. So we are trying to involve especially the survivors in this advocacy journey, because it is not something that you go and discuss it without involving them. Another thing that we are trying to say is that we need willingness from our government, because cancer does not have a budget, especially the advocacy. They have not given it a budget, and you wonder in health, when they give a budget, they give a budget of NCDs as a whole. So you realize that we have several, quite a number of NCDs, and yet there is no allocation down to the community level. And on prevention and early detection, I can say that in most cases, you go to 2 hospitals, which is dispensary down there at the community. Nurses are not trained. They don't know what to do. They don't know the signs. They don't understand signs and symptoms of cancer. They don't know anything about cancer. And even them sometimes they're surprised when they get to be tested with cancer. They get surprised, and sometimes that they panic, yet they're in the health system. So those are some of the issues that we are trying to advocate and urging our government, so that they need to start from the community level. Another thing is training the community health volunteers. You see, when community health volunteers are trained and they are involved in cancer advocacy down at the community level, it's easy for them to reach out to households, treat them. Look at the HIV advocacy in Africa. It has been given junk of money, and everybody in the village, including a young child, knows that HIV symptoms and signs are all these things, how to get HIV, how someone can contact HIV, and so on and so forth. But with cancer, it's still dormant. So we are really trying to urge our government, so that we need to start training community down there, so that when they we should be having NCD. We should be having NCD included in curriculums, so that they can be taught in school. So when the child is growing up, they need to know what NCD is. They need to know all types of NCD. They need to understand. As they grow up, they reach. Sometimes someone has gone to university. They don't know the signs and symptoms of breast cancer. They don't know. They only listen to myths and misconceptions. They listen to a number of things that doesn't help. So those are some of the issues we need we are urging our government to put in place, so that it should start down from the community. So when it reaches up, then it's easy to manage. And then the screening point should be down at the community level. Those are some of the issues that we are really trying to advocate. I want to thank Dr. Nasibu for what you are doing in Tanzania. And we have quite a number of things that can also be done in our country. And I just want to say this before I finish, to thank the government of Kenya, because they came up with a cancer strategic plan for 2017-2022. And there is an act of the parliament that was also came out. And also it is about cancer treatment. Yeah, so they are trying. Another thing is that cancer treatment is very expensive, and most of the African countries, they have not included it into national medical cover scheme. So people are still digging deep into their pockets to pay for treatment. So those are some of the issues we need to tackle. And thank you so much. Maybe when time comes, I'll come.
Yeah, and I think this is an important point, that health is wealth. We've been shown that with COVID situation that health is wealth, and look at the amount of money that's been plowed into COVID now in terms of test and trace, and all over the world, the disruption in the economy, for example. Whereas if we put preventative measures in place early, which we know what's coming, for example, in the health economy, we're going to be short of 18 million staff by 2030. Okay, that's around the world. And we've got the predictions by 2040. I think nearly 30 million people will die from cancer. It's our job now to put the measures in place that we stop that happening. I'd like to ask Stephen if you could give us a practical example of on the ground, because you have these talks from a nutritional perspective, because you're really at the coalface dealing with these issues before they arise. Could you just tell us a little bit about those nutritional talks? And then what we'll do is we'll have a final round around the group and ask people for their, shall we say, thoughts of the future, and then we can close up. I think you're on mute, Stephen. There you go.
Okay, thank you so much for this wonderful opportunity. Thank you for this wonderful opportunity that you have given me, that I may say something as far as nutrition is concerned, as we are dealing with the cancer patient. Number one, we need to understand that nutrition plays a key role in our, because even to have woken up, at least you've taken something. So when it comes to nutrition, is cutting across. And so I'll begin by saying that when you are dealing with the cancer patient, what exactly do you need to understand with the nutrition? And we need to know that nutrition comes because we want to achieve certain goals as far as medication and treatment is concerned with cancer. And some of the basics that we need to underscore back in our mind as far as we're dealing with cancer patients is, number one, we want to keep a healthy body weight to a cancer patient. And number two, we want to maintain strength, because some of the effects of the radiotherapies and the chemotherapies are the loss of weight. And also, we need to keep the body can be replenished back when we put the right track every patient to every caregiver, that at the end of it, they are able to replenish these loss. Nutrition is actually the center core as far as dealing with the cancer.
Sorry, Stephen, we're losing the signal. It's breaking up pretty badly.
Of the chemotherapies, because that is number one thing that. Okay, let me go back. I think it is the network problem, but I'm trying to say is that nutrition comes into a cancer patient because, number one, we want to maintain a healthy body weight, and number two, and also we want to keep the body tissues healthy, back to normal, because somebody who is undergoing cancer treatment, there is the loss of body weight, there is change in the appetite, there is a lot of diarrhea side effect. All these things, we need to bring them back nutritionally. And that is why we need to understand the center which nutrition plays as far as cancer treatment is concerned. And one thing that we are struggling with in Africa is that even in our curriculum, in the universities, there are not much even impact. People are saying like nobody cares whatever they eat. That they say that they're not really putting into consideration what am I eating until time comes.
We're losing you, Stephen, unfortunately. I think I get the message. Can you hear me? I think we've lost the signal there. Let me just pick up on this around nutrition, which is very important. And I think Stephen was trying to talk about the recovery phase of when you're going through treatment. But also then I think he was just about to talk about, you know, the next steps in terms of, he was talking about in university, and we've all been through this as in our youth. We believe that we are almost, shall we say, bulletproof, and we can eat and drink and do whatever we want. I think one of the things that I've learned is, you know, if I could go back 20, 30 years even, to embrace nutrition would have been, you know, a real key factor for us. Jenny, maybe you could tell us a little bit about how in the future we can address that in the schools and with programs in universities, because it's such an important point. And I think, you know, social media could actually play a big role in that.
I definitely think that we need to kind of look at new ideas to engage with youths. So I think we're in a good time in terms of social media. So you'll find, you know, a lot of the children are kind of in Instagram, Snapchat. So I guess it's kind of finding, you know, using those platforms and those channels to kind of provide education, to provide information, to kind of make, you know, these things accessible and to kind of provide learning opportunities. And to also, I think, we also have to act, you know, we also have to kind of lead by example as well. And I think when you're dealing with youths, as much as, you know, as adults, we think we kind of have the information and we have the tools and we know everything. But I think it's also providing that platform where we can kind of listen to their views and listen to their stories, because they're the future. And, you know, we have to take that into consideration, that when we're engaging with these young youths, that we kind of give them a platform to
how do we though address patience with youth? Because we live in a society and in a world now where unless it happens instantly, people are unhappy and they don't stay switched on. One of the things I find fascinating around youth engagement, which, you know, we try and mentor and you try and support youth in as many ways as possible. But it's patience. They expect things to happen instantly, like it does on their mobile phone. I would really love to know, how do we address that?
I also think a lot of it is also, you know, from my engagements that I've had with youths, I think the most frequent feedback that I've had is that they want to engage with people that have had the same experience as them. So they want somebody they can kind of, you know, provide that experience and listen, opposed to criticizing and critiquing them. So I think there needs to be something around us being transparent and us being open, and also being open to, you know, potentially being criticized, and, you know, and I think looking at different methods of engaging with youths. So, you know, you have some youths that I've engaged with where they're open to kind of have these dialogues, where you have some that are slightly a bit more reserved. So I think it's about finding places where we can kind of, depending on that particular individual, where we can kind of channel their ideas and also, you know, engage with them and let them have a say and let them, you know, lead and take control.
Yep, I totally agree. And then I'll come to Naz. Just when we talk about engagement and that, and it was interesting there, Jenny, when you're talking about it, it's that understanding of the youth engagement in relation to cancer. And we have a lot of events around the world, Naz, like the cancer runs that we have here, and I know the walk in Kenya as well. But I always find it very interesting and fascinating how local health authorities don't engage in these runs and these activities, because we have like thousands of people there. Like sometimes some of these events have hundreds of thousands of people. Is this not an opportunity for the local health agencies to actually disseminate information en masse? Would you see that as an opportunity?
Yeah, I think this is a big opportunity, Miss. Like, if I go back to Dr. Helen Makwani's work, for example, she goes to churches, to go to school, to institutions, go to mosque, talk to people, because in Africa, like every Sunday, most people will go to church, and if you have important information to to pass on. If you go there, just even 5 minutes, you don't need the whole day. In the 5 minutes, just give some small bites of information that people can understand, and using the clergymen or the sheikh or the padres and things like that, just to give that information as well, because it's like people have can a lot of unknown. They don't know. We don't talk about one of my colleagues was talking there. One is Humphrey about talking about the cervical cancers or breast cancer. Those are things they're taboo in African culture. Okay, and if one of your parents have let's say find a lump on their breast, they're not gonna talk about it to you. So I think if we bring it to the open and make it like a normal thing, talking about a pain in my hand, the same as pain in my genitalia or my breast, the normal thing. It's no offense because this is life. And I think so using those gatherings, that going to the schools and they listen to the people, what are their concerns, okay, and what do they know about let's say cancer, what do they know, and then listen to what they know. Then from there you can unpick what they don't, what misconception they have about the problem, and then you can engage in these dialogues, and the people can learn, because when you talk with people, that you learn from their point of view what they know, and then they can learn from you as well what they don't know. So I think that is the key issue, because early diagnosis, when it comes to cancer, early diagnosis is very, very important, because we can do something, and if you catch it early, you can do something about it. So yes,
I'm in total agreement there. As I think early diagnosis, and people have a lot of fear and they're afraid, and I think you made a great point around the faith community and their role in this. I'm very grateful. We are working with Pope Francis's COVID Commission, and one of our roles within this is looking to the future and how do we engage in the future with the faith communities. They have such a critical role to play in the health and well-being of the communities. And just for people who don't know the context, with Caritas and the Catholic faith, for example, they have 26% of the health economy in the world. So they are a huge player in the health economy. So we have a great opportunity to engage. Humphrey, you spoke about, the cancers that are prevalent in Africa and in Kenya and in other areas. Can digital technology help with this dissemination of information, this sort of forum, these platforms? Can this be a way of the future? Is this an engagement platform that you see growing and developing in communities?
Okay, yes, thank you. Yeah, absolutely, Gareth. Digital platform, more so with the corona epidemic, it seems that's the direction to go. And first, maybe before I share more on the digital platform, we would like to acknowledge the Kenyan government developing the cancer policy for the first time that runs from 2019 to 2030. And it with the key highlights of incorporating the school health factors, the risk factors to cancer in the school health policy and education curriculum. As well, currently there is integration of cervical cancer screening and physical breast.
Have we lost you, Humphrey?
And more specifically into the technology, the use of technology. Currently, if we even look at how our support group has been operational, it was majorly a physical meeting support group. But with Corona, we can't really hold those meetings. So we have to go through the Zoom meetings and the WhatsApp. So technology, it creates much awareness. I know for the youth, they are really tuned into their phones and majorly into the internet. So anything which can be shared into the internet, be it on cervical cancers or all types of cancers, as a mode of creating awareness that will reach most of them. But I still agree with the panel that a lot needs to be done, because even if we compare HIV and cancers, we find that HIV currently there is even testing in churches and mosques and even chief barazas. So the diagnosis is they are going for the diagnosis as early enough to and at the root, the simplest and the community level, or the first individual who can be identified. And if you look at cancer, no one wants to talk about it. So very few does. So if you can really maximize on the internet platforms, the digital platforms, to talk about it and create awareness and advocacy in general, that will be good to go. And maybe lastly, first, creating public awareness on cancer is one thing. Like in the African setup, you can talk about cancer, and you may find some who even know the risk factors to cancer. But the big question is, how will this old man or this Kenyan in a rural setup avoid these risk factors? Because all he has, maybe he has a little, and the little he has is just for food. He can't really prioritize which is the balanced diet that I need to work on, as maybe Steve has said. So how do we really take it? If you look at maybe in terms of, you are talking about balanced diet, you are talking about fruits now and again. This guy can never spend even a coin on buying fruits. So the big thing, what next? After talking about the awareness creation, at least people really know what cancer is. They know what the risk factors are. But now, how do we help them to work through the risk factors to avoid cancer affecting them in future?
Yeah, and this comes down to having a perspective as well. And I think if you look at COVID-19, and this is where I'm going to speak to Lamech, for example, or sorry, to Stephen next on nutrition. As soon as, we have COVID-19, we straight away go for the vaccine, so it's straight away we need to have a vaccine, whereas we should be boosting the immune system first and foremost, which is through nutritional way, which is one of the ways that we can offset the impact of COVID-19, for example. This is what we covered in our Corona perspectives with our partners. Stephen, in terms of the nutritional side of it, it's going to play a vital role in the future of prevention. As Humphrey was saying, how do we make that information meaningful for those in rural locations? So perhaps you could just give us a very short insight into how you feel nutrition can be meaningful to those who need to know what's good for their body. Go ahead, Stephen. Can you hear me, Stephen? Or you're on mute if you can. Let's see. What we can do is we can go to Lamech, if you're there, Lamech, and perhaps you could just give us a short summary of the next steps for Kisumu City Cancer Organization and what you see the next 12 months holding.
Thank you so much, Gareth. What I can say, we have a long way to go, and we need to rally behind us. Young people, youths especially, because they are very much energetic. They have a lot to share through social media, and also we need to rally behind us, or we put them in front, the survivors, because they are the voice. They are the voice that when they speak out there, they have the voice that when they speak out there, people will listen to their stories, and people will take precautions in terms of seeking health behaviors, whereby they will go for screening, they will check themselves every now and again. Because if we put them in front, if we've listened to their voices, then it will really, really help us. Another thing that I want to say is that we normally involve churches, schools. Before Corona, we used to go to churches, schools. We used to go to markets. Sometimes we make a loudspeaker, talk to people about cancer, especially during the month of October, whereby we do a lot of advocacy on breast cancer. forging forward in terms of our partnership with the Wish and everybody here, we are looking at how can we do this at the community level? How can we empower our community in terms of trainings, more of trainings to the community health volunteers so that they can reach out with this message to the community? I think those are some of the areas we need to look into. Again, we need to have to share CMEs with the doctors, CMEs with the oncology nurses. There is another aspect that has been left out, psycho-spiritual support, intervention to the cancer patient. It has been left out in cancer management in Africa. It's not there. Nobody talk about it, and they go through. So we need to have some trainings on the same, so that we empower people who can come out to practice psychosocial spiritual intervention. Yes, so those are some of the areas we can look into advocacy, but there are so many other areas we can also look into.
And I totally agree with you. That plays such an important role in the outcomes as well, in terms of, you know, the outcomes for the patient. It's that spiritual well-being has a vital point to play in this conversation. So, look, it's been a great discussion this morning, and I'm very much looking forward to the future and working with everyone across the board here, particularly in Africa. And myself, Jenny, and Naz have had many conversations about, we have so much belief in how Africa is going to drive positive change. I truly believe this in terms of health and well-being, and can almost lead in terms of prevention, and focusing on a methodology that provides, you know, that showcase prevention at scale, empowers local communities to improve their health and well-being while creating opportunities. So that's very much what the WISP platform is all about. I just want to say thanks to the guests this morning, to everyone who's joined us to see today. We'll have this is streamed live on YouTube and Facebook. It'll also be downloaded as a podcast, and we'll share it. And we'll have Kisumu back online in the next couple of weeks. We'll follow up on this journey, and you'll see Jenny and Naz, who are working very closely with us as we develop these programs. And we hope to have some news around our some pilot programs that we will be launching in Africa soon as well. So for any further information, see wis.uk. So thanks everyone for joining, and goodbye this morning. Bye bye.
Asante sana.